Okay. All right.
Okay, so next question says, Dr. Rand, in your opinion, is there a peptide or a combination of peptides I could use instead of TRT? Yeah. Depending upon your age and whether your diagnosis is secondary hypogonadism, meaning the testicles are working just fine, they're just not getting a signal typically from the pituitary, or definitely from the pituitary, but if it's originating from the pituitary or the hypothalamus, then yeah, there's plenty of peptides that can be used. You can use HCG, you can use, I say plenty, HCG, kisspeptin, okay? Those two are going to be your go-tos when you're talking about peptides. Don't forget there is in clomiphene, one of the isomers of clomiphene. Have we talked about this before? Or we talk about, I am not a big fan of Clomid, clomiphene citrate. Okay. Clomid is the brand because there's two isomers in there, one of which is called zuclomiphene, has a much longer half-life, and we believe that it somehow acts with the estrogen receptor while it's blocking some or all of them, but somehow reacts so that it makes you feel like you still have the estrogen there, meaning kind of moody, irascible, depressed, homicidal. Not a good feeling, whatever it is. And so we've separated that into its components, the two isomers, and now I prefer using N-clomiphene, much shorter half-life, as effective, but without the side effects. Okay. That's not a peptide, clomiphene, but it is a serum that would help raise your endogenous production if you had secondary hypogonadism. If you have primary, meaning primary hypogonadism where the testicles just aren't able to function like they're supposed to, then no, a peptide's not going to be the answer for you. We don't have something that acts like testosterone but isn't, or will replace. Well, yeah. I mean, no. People will confuse SARMs oftentimes, right? And those are used as androgen receptor replacements, as it were, right?
Yeah.
But that's not the question.
Yeah.
So, I think only if you're talking about secondary hypogonadism would a peptide be appropriate or available.
Okay, good. Thanks, Doc.
This is the one that it was sent to me yesterday, right? Yeah.
Yeah.
Or Monday. Doc, what is your opinion on stacking compounds? How many products would you say is safe at most? 2 to 3? Thanks for your time. Love the show. Well, thanks.
That's a good one.
Yeah. Compounds, that's an open question, right? Stacking anabolic steroids, stacking steroids with anabolic steroids, stacking SARM, stacking. What does stacking mean? So, and I don't mean to be...
Well, when bodybuilding, I mean, the guys that are competing today, I mean, you should see their laundry list. I'm sure you've seen some of that stuff that they're doing. It's like 10, 15 products.
So that would include everything.
Everything.
Okay, so, well, I don't know if there's a limit per se where you go, okay, well, you can only use 3 different things and that's it. Because, the proof, what you mentioned, I don't know if 16 is appropriate, but... Well, so think about some of those things. What would guys use besides insulin and an anabolic steroid and a testosterone base? And of course, an estrogen modulator, an aromatase inhibitor, let's say. What else would be used that we would consider a compound that would be stacking? Do you know?
Well, just the different kind of steroids. I mean, if you go from Winstrol to Primobolan to Deca to Equipoise.
So multiple anabolics.
Right.
And growth hormone or IGF-1.
All that stuff, you're right.
Or other peptides, right? Thymosin beta-4 maybe, or BPC 157 because they have an injury or something.
Yeah.
So,
is it worth it? I'm sure the question is it worth it to actually do all that kind of stuff? Is it really worth it, or is it overdoing it? I mean,
well,
what do you think?
The first part of that question is really up to the user, right? I mean, at what cost, literally and figuratively, if there is a cost, like, aside from financially, well, if I use a lot of testosterone more than I should, then I'm going to have to use more anastrozole, for example. So that's a cost, not just financially, but pain in the butt. And then safe, okay, that's another issue. I would argue that, I mean, I have a big thing against using insulin because that can kill you.
Yeah.
I don't see thymosin beta 4 killing anybody. I don't believe there's even an established LD50 for testosterone. In other words, a lethal dose of testosterone, I don't think has been established, right? Because it doesn't kill you, even in super high dosages, but insulin can. SARMs, again, I don't know of lethal doses of SARMs. So I suppose you could stack those things we mentioned without really a big concern, certainly in the short term. But of course, long-term use of, for example, growth hormone in high dosages, like some of these guys I've heard are using like 9 IUs twice a day, you're going to probably experience some side effects. Not probably, definitely. Okay, depending upon how long you're using it. We know this because, for some HIV patients that use it for any number of reasons, there's some side effects that come with it. And of course, they're using it for different reasons and arguably because they really need to, but they're still stuck with the side effects. So with some limitations, I would say, 2, 3, 6, 9, whatever floats your boat, and we can include supplements in there. I don't know of any contraindications where, again, I think the question is trying to imply like once you get to a certain number of stacking things, is there a problem?
Yeah, I think so.
I don't see, but the problem is though, think about it from a scientific perspective. Well, let's start with the androgen receptor. How many products can hit that androgen receptor? You mentioned switching, but a lot of guys, for example, will use Anavar and Winstrol, and you go, what's the point again? Or Anavar, Winstrol, and Primobolan.
They don't know.
You got cousins, right? All DHT derivatives, all very similar in effect, and you go, well, even if they weren't, even if they were very different, you had Anadrol with Primobolan, and you go, well, there's only so many receptors. How do you know, which one's getting there first? Do you assume they both wear the same pair of tennis shoes and get there at the same time?
They don't know.
50-50?
Yeah.
So in that regard, that's kind of a waste of time, not dealing with the safety aspects. I don't think it's a safety issue. But from a science standpoint, what are you getting out of that?
That's the question, I think. I think people... I think a lot of people that are competing, especially, will just throw a kitchen sink into the whole process. And just to make sure they have every single door covered, they'll take everything.
Well, the problem with that is I can get that to some degree. If you think about it, you say, okay, let's just use a number example. Like, I can use 100 of something. Just keep it simple. And with my evaluation of my body type, I want 80% of the anabolic effect and 20% of the androgenic effect. So a lot of people, like, for example, love the androgenic effect of Anadrol. Oh, I get way better leg workouts because it makes them psychotic. So they say, I want to keep 20% of that, but I want and so they'll go, okay, I'll use a blend of 80 of that number of the saturation level, 80 Primobolan and 20 Anadrol. That to some degree makes some sense. You figure, okay, 80% of the time, assuming they both wear the same pair of tennis shoes, Primobolan is going to be affecting the androgen receptor. Another 20% will be the Anadrol. You know what I'm saying? So, but then when you go, okay, I'm going to use 3 grams of this and 2 grams of that per week, you're going, okay, now what? And then it really gets confusing because what if they don't, and they probably don't have the same speed? They don't wear the same pair of tennis shoes. You're really confounding it. And really all you're doing is you're wasting your Primobolan. Yeah. Because most of the time Anadrol is getting there because you're using so much of it and slightly faster, but it adds up with that ratio and that amount. So you're following all this, right? So from a science standpoint, you go, okay, that doesn't make sense. That's not his question. Well, you're asking my opinion on stacking compounds, so I guess you're getting an answer to your question. Yeah. But also, when you're using 16 different things, some of which are very different from one another, human growth hormone is totally different than any of the cholesterol-based, hormones like the steroids we're talking about. But let's say you're trying to lose as much fat as possible. Growth hormone is a great tool for that. We know that. The DHT derivatives we just mentioned, Primobolan, Anavar, and Winstrol, are great tools for holding muscle, but also for losing fat too. How do you know which one's doing most of the work?
That's right.
Now, some will say, well, I don't need to know. I know they both work on fat, and I'm just trying to look, on stage, we're talking about bodybuilders, and say, I want to look as lean as possible. Okay, I get that. But at the same time, you go, but how do you know you couldn't have done it with just the growth hormone and not wasted this in so many different ways? I'll use the term waste, But again, I can get the argument against that. But then you start throwing in other things like, remember when it's a beta agonist, starts with a C. It's not albuterol, clenbuterol.
Oh, yeah. Yes.
And it might still be a big thing. How much is that really contributing? Oh, but you got to have that. Or one of my favorites, okay, is thyroid. Okay, we've proven in study after study that increasing thyroid, okay, is not going to help you lose fat. Okay, now, sorry, if you've got if your thyroid is already operating the way it should, if you've got sufficient thyroid, adding more is not going to do anything for you.
Yeah.
Unless you get to a point where now you're hyperthyroid because your body stopped producing thyroid and you're overdosing on thyroid so that it can't shut down to lower the level anymore into normal range. It's off the chart. Well then, because I call it your idle speed is higher than it should be, you'll burn a little bit more fat 24/7, but you'll also be bug-eyed and miserable, anxious out of your mind because you got too much thyroid in you.
Yeah.
So again, at what cost would you do that? Now, for the average bodybuilder or any athlete or anybody who's trying to do this, I always assume it's, a certain crowd, and I don't mean to. But what good is that going to do? You have euthyroid, all your body's saying, sure, go ahead, make my life easy for a few weeks, and I won't produce as much because you're replacing it for me. But it's part of that 16 compound stack. Mm-hmm. And this is what I've seen over the years is people I'll go through this and say, yeah, but I still think I should take my Cytomel. Okay. And it's because you can't ever tease it out unless you do it the scientific way and this is hard to do, I realize. Each time you, let's say, diet down and try and get down to, 4% body fat, you only change one thing each time you do it. Well, that's going to be, if you're using 16 different compounds, that's going to take you 16 different times to cut down, right? Yeah. That's a lot of testing and a lot of work. So I don't want to belabor the point, but I think I made the point.
Yeah.
So use your noodle to determine not just what is working, what's worth it, what your goals are versus what you're getting out of it. Is the juice worth the squeeze?
Right.
But from a safety standpoint, I think you're probably mostly pretty safe because I can't think of anything where you go, oh, those are contraindicated. With the exception of, and I might be not thinking of things I haven't mentioned, which I reserve the right to say, ooh, well, you didn't tell me that one. I didn't think of that one, I should say. Yeah. But insulin, no bueno. That one I'd be very careful with, and I don't recommend it at all. I think that's a risk not worth taking, and I know I'll get a lot of feedback about that. But you know what?
That's your opinion.
Seen some problems, and I don't think that risk is worth it. That's for people that have a problem with the pancreas, diabetics, and there's much safer ways to drop fat and get some muscle deposition.
Awesome. Thanks, Doc.